My mum and dad are getting older, and I'm witnessing their journey through the health system. And as a very interested observer of that, I'm noticing that there are certain things that are taking place that are perhaps not lined up with their interests. And I know that many people watching this will perhaps be facing similar things, either personally or watching their family members go through the same process. This video is going to give you 4 questions to take to your healthcare professional that's going to help you to line up your interests with their expertise. Welcome back to LOTED. We are learning one thing every day. My name is Wayne. I run Learn Well Books. We are an international best-selling book publishing house. A lot of the content for today's video comes from a book that we recently published all about excellent health. We've also consulted with research done by Dr. Marty Macquarie and Dr. Kevin Jones for the content in this video. A large part of the reason for this video is because there's a deep dissymmetry or difference between the knowledge that doctors have and the knowledge that we have. And that's not to suggest for a moment that doctors are not good people. Most of them are great and they're doing very good work. But the system has created incentives and blind spots that mean that your interests can sometimes not be well protected. The questions that I'm going to share with you are designed to align your interests with the expertise of the people that are meant to be looking after you. Specifically, these 4 questions are designed for a conversation that you might have with a doctor that's going to conduct an operation. These aren't necessarily questions you would ask your GP. And as I share these 4 questions with you, I'll be referring to my notes here just to make sure that I get the wording correct. And I invite you to write these down so that you're equipped for the next conversation for which these questions are designed. My most recent recollection of a conversation like this was when I accompanied my mum to a hospital where we sat down with the surgeon that was going to conduct an operation on my mum's legs. This surgery was vascular. It had to do with her veins. And whilst it wasn't a high-risk surgery, there was definitely the chance for complications. My mum's elderly. This is a rather invasive surgery, and I was particularly concerned that my mum was making all the right decisions. I didn't have access to these questions at the time, but I wish I did, and I wish I could have shared these with my mum. Thankfully, her outcomes were good, but the whole scenario was certainly not without a fair bit of stress. So here are the 4 questions that would have made a big difference, and hopefully these are something that you can use perhaps in a similar circumstance. Question number 1, what would you do if you were me? It's a simple but powerful question. You see, the protocols of doctors are built for populations, not necessarily individuals. And this forces individual responses rather than just standardized responses. Here's question number 2. During the process of organizing an operation, there'll be all sorts of legal forms, consent forms, and they manage a standardized suite of risks. However, this question gets the doctor to think about the specific risk in your case. The question is, what's the risk that gives you the most pause for concern? And a doctor in response to that might say something like, honestly, with your anatomy, I'm most concerned about X. And whilst all the legal forms might cover off on the basics, this is designed to get the doctor to consider and respond specifically for you. Question number 3, and I think this one is really practical. Who will be taking care of me after my surgery? The answer you want is, I will see you regularly until you're fully recovered. The answer you might often get is silence or a vague mention of the team. You might continue the question to say things like, will you be actively participating or just checking in? It's during the post-operative care that a lot of the complications can be caught or missed. And question number 4, this is probably the most contentious one. It's, what do the other nurses and staff say about you? Now, you may choose to ask this question to staff or nurses directly instead of the doctor themselves. I feel like the people that know most about how the doctors operate will be the people that work with them. For example, they'll know whether a doctor would take seriously a complication or just dismiss concerns. This inside information trumps any degrees or charm or expertise, and this really gets to the heart of the level of care that a doctor may have for his or her patients. Here's what to do practically with this information. Please write down these 4 questions and take them with you next time you've got a conversation where these are relevant. Nothing about this suggests that you ought to take an adversarial approach. If anything, good doctors will appreciate your questions. They'll know that you're informed and expecting partnership rather than you just passively handing off authority to them. I truly hope that these questions may stay with you and work for you in a situation where you most need them. In all cases, I'm wishing you the best of health, and thank you for watching LOTED. We are learning one thing every day. I'll see you tomorrow.